Welcome back. We're moving on to why is it important? The all-important question of why. Why go to the trouble of talking about physician engagement or even defining physician engagement if we really don't understand exactly why it's important? And we'll have to talk about why it's important for various stakeholder groups, but I think it's important for everybody to walk away with at least some working knowledge or at least some working definition of how this is important to organizations and then also to the people who work within those organizations. So we're going to get back to this idea of physician engagement, but I want to do it through the why portion of it first, and then we'll move on to the specific 10 rules. So you've probably seen this infographic. It's out there on the internet all over the place. Came out of Red Letter Days, and essentially what it's doing is describing sort of the highly engaged and the lower no engaged employee. But for all practical purposes, I think most people would agree this would apply to anybody, whether employed or not employed. You know, having someone who's talked about their progress, someone who encourages their development, someone who's praised them recently, somewhere where they can go to have opportunities to learn and grow, and you can move down that list. Essentially, there's a couple of things I want you to observe on this, which is the first one is this idea that there's definitely highly engaged and then the lower no engaged type of person. The other is take a look at this list, because what I think what it's really saying is that the more we people who are trying to develop engagement are trying to get there, we get there through what people value. And so that's a list of essentially what a person values. And if they get the sense that the organization that they work with or work within is valuing them, they're more likely to feel engaged. The other thing it's telling us is this. This idea that people are engaged or not engaged. When you start your first day in the work, you're probably fairly engaged. So something's happening over time that's moving you towards the right-hand side of the column there. You're becoming more disengaged or less engaged over time, and that there are things happening within our environments that are driving that. And so it's this idea that we all start with I think, a fairly engaged attitude when most people start their place of work, whether you're coming in as an independent physician or if you're a physician who's in an employed situation. I don't think it really makes a difference. I think most people generally start that first day as pretty amped up and ready to go. But over time, something happens, and we become more and more disengaged or less engaged over time. Or we don't. We somehow manage to maintain that spirit of engagement and keep carrying that forward. So this idea, two things again, that there are things that are driving this, and that somehow we can do things, either start doing things or stop doing things that are moving people from the left side over to the right side. Or if we find somebody who's already disengaged, we can start doing things or stop doing things that are going to move them from the right side over to the left side. And so I'm going to use that as a basic principle of what I'm going to talk about when we get to the 10 rules. So why do we do this, though? I mean, particularly if you look at a lot of the studies that are out, this just happens to be out of Towers Perrin, this is 2005, but I can tell you, I quit polling studies because they're all basically saying the same thing. Engagement's important. Why is it important? Because it positively impacts the quality of the organization's products. And when we're talking about healthcare, the products, in a sense, are our services, and that is what we're doing to improve patients' care. So we can improve patients' care purely by being more engaged. Isn't that amazing? How we, as providers, can make that difference. Not only that, but we who are in administration or in management can start doing things that impact our providers so that they can improve the services that they're delivering. That's pretty, I think, very amazing when you think about it. This idea that if we can get people to become more engaged, that we're going to have actually better care for patients. And that to me is a mind blower, because I love that idea. The other is that it positively affects customer service. There's no doubt. I mean, everybody's had that experience where you walk into a coffee shop or something like that, and you could tell you got that employee who's just not engaged, and you're just thinking, oh God, please just don't, it's just you just got to pour a cup of coffee here. I want to get out of here with a smile on my face, and so you don't want to. You don't want to find that too often in life, but unfortunately we do. It's the same thing. People come in and see us and they're already sick, they're already feeling down, and so having somebody who can kind of turn them around a little bit, purely by their attitude, by their engagement, I think is awesome, because that's the way I think we deliver care. at least high quality care. And then another one here, positively impacts costs. We're constantly getting constrained by costs within healthcare, decreasing revenue and then increasing expenses, and margins are getting squeezed on a daily basis, and we're constantly trying to figure out how do we maintain that, how do we develop those resources, that margin, so to speak, that will be able to help us pay for the work that we're doing, and not only that, but help us provide more resources and have them available for patient care. Because to me, that's really the way it should be working. We should be taking those resources and put it back into our institutions, into our people, and into our patient care. So here's another one. This is a couple studies, and one of them looked at what happens with disengagement, and that is that it leads to less revenue. So we're talking about that environments of decreasing revenue. And why engagement is important is because we want to be able to maintain that revenue flow to support the facilities where we're working at. Also leads to higher productivity and higher profitability. It just kind of makes sense, higher revenue, lower costs. Yeah, sure, it's going to be more profitability, but I like this idea of higher productivity, because if you're a patient, you want to be able to get through that system as fast as possible and the best possible outcomes that we can get. And so that's why engagement is important. We're ultimately trying to deliver better patient care. In order to do that, engagement is a key piece of delivering better patient care. So it's a key piece of making sure that what we're doing is helping patients, which is what we got into this for in the first place. So if that wasn't enough, here's a survey of 157 C-suite executives, and you can see they have the top 5 areas of greatest opportunity. And number 1 was engaging physicians in cost and quality improvements. That shouldn't be a big surprise. That's why it's important to them. But it's also important for physicians because we're going to be the recipients of that. People who are working to help us become engaged, I think, is going to not only help the organizations we work at, but also help us personally, right? Remember, we're talking about that. What are those things? What is that definition that we had of physician engagement? And so I reworded this a little bit. And that is a physician who is fully involved and enthusiastic about his or her work. It gets back to Tim Rutledge's basic definition that I put up there at the first section. And also a physician who is actively improving their healthcare systems, clinical operation, and financial conditions. And this really gets back to this idea of what administrators are really trying to drive with us, and that is that, look, you impact everything that happens in an organization. And those resources that we have left over at the end of the day are things that we could put back into the facility, put back into the people, and basically put back into patient care. And so in order to do that, we need everybody's help. We need everybody's engagement. And physicians are a key piece of this. I also think a physician who is actively improving their healthcare system's patient and staff experience. And so the patient experience, I think everybody understands. It's important for improving outcomes. But the caregivers, the staff who are taking care of them, the nurses, the techs, everybody who's involved in that patient's experience needs to have their experience improved as well. So if you're out there making everybody having a bad, and giving everybody a bad day, you're really not contributing there. And so finding ways of avoiding to do that is going to be a key piece of this. So to me, a physician who is fully involved and enthusiastic about his or her work, actively improving their healthcare system's clinical, operational, financial conditions, as well as patient and staff experience, is a pretty good working definition of physician engagement. And so we're going to stick with that one throughout the rest of this course. And so we're going to move on to the next section, and thank you for hanging in there so far, and please click to the next one.